and welcome back. When your child is having difficulty in school, maybe trouble focusing, or perhaps even some behavior problems, you really want answers and you really want help. And Focus MD offers an accurate diagnosis and specialized treatment. Dr. Joanna Geoghegan joins us now with all of the details. Welcome, Dr. Geoghegan.
Thank you.
So happy to have you here. And ADD and ADHD is something that's kind of near and dear to me because I have two sons who were, I guess you could say, diagnosed with it in their younger years. They're now 16 and soon to be 14. But what makes Focus MD so different when it comes to diagnosing? And let's also talk about when it comes to treatment.
Sure, absolutely. Well, Focus MD is a unique idea. It is a medical practice that just specializes and focuses on ADHD. And we treat adults, children, and adolescents.
Wow. Now, do you find that, especially when you mention adults, that some of them have gone undiagnosed for years? And what would be some of the things that you might notice that would, raise some red flags?
Well, ADHD stands for Attention Deficit Hyperactivity Disorder, and the name kind of says a lot of symptoms right there. And it is true that a lot of adults do go undiagnosed for years, and that's why we do like to catch it in childhood, because it affects their learning in school, it affects their home life, it affects after school life, extracurricular activities. It's really a multifaceted problem. And the core symptoms are inattention, hyperactivity, and impulsivity. And those can present in different ways. Sometimes patients have a combination of those, and sometimes they just have inattention. So that's the child that's a great, perfectly mannered, but perhaps they just can't stay focused.
Right.
They are easily distracted. And then you have a patient that may be mainly hyperactive, and that's the patient that has a hard time sitting down.
Absolutely. My son would stand up to eat. It didn't matter. Do his work in class, homework, standing up, eating. Can you sit down? It's like, no.
Yes, or even, tapping the pen a lot or shaking the leg. Those kind of symptoms are typical of hyperactivity. And then you can have a combination of the two. So those are kind of the three subtypes.
Now, what you find, because you specialize in that area versus maybe going to a pediatrician and being diagnosed in that manner where they just sometimes say, okay, is he experiencing this? Are they experiencing that? And they write out a prescription for you. You really kind of do more of a something that's tailored better to really narrow that down and to give the right diagnosis.
Yes, exactly. So when I was in private practice as a pediatrician, we had subjective questionnaires that the parent and the teacher would fill out.
Exactly.
And those are great questionnaires, but what the problem is that sometimes they're so subjective that they can overdiagnose or underdiagnose. And what we have now is and what is unique to Focus MD is we have an FDA approved objective test.
Is that the QB test?
That's the QB test. And what we do is we couple that objective information that we get with the QB test with the subjective information from the questionnaires to really give the most accurate diagnosis and make sure we're not overdiagnosing or underdiagnosing or giving the wrong diagnosis to the patient.
Now we have about a minute left. Let's talk about treatment, because I know personally what I've experienced with my son's medications in the mood swings, and when they come off of it, it's just, they're different people. But you work with the patients with that and help them to manage some of the symptoms with treatment, right?
Exactly. We spend an hour with the patient in the first consultation, and that includes the evaluation of the patient, the QB test, which is the objective test, and then further counseling with lifestyle management tips and things like that. So we really have a lot more time to spend with the patient, and then subsequent follow-ups are 30 minutes.
Okay. Oh, that's awesome. So there you go. So if you're a parent out there and you have a child that you might suspect could be ADHD, or maybe you're an adult and it sounds like what we've been talking about sounds a lot like you, and we're describing your behavior, they can get a consultation first, right?
Yes.
And what's the best way to set one of those up?
The best way to set one of those up is to call our office and set up an appointment with our administrative assistant.
Okay.
And we'll definitely see you.
All right, there's a number right there, and also the website. Dr. Geoghegan, thank you so much.
Thank you. Thank you for having me.
I appreciate you.
Thank you. Appreciate it.
Now over to John.
Trial Tuesday once again. Of course, we've been hearing about NASA.